Hi, I'm Dr. Jackie. I make videos about child and adolescent psychiatry. If that's interesting to you, like and subscribe and join the team. Today we're going to talk about the difference between psychology and psychiatry and what that means for you when you're choosing your career path. The biggest difference from where I sit is that psychiatry required medical school. And so you have to complete all the prerequisites prior to attending medical school. You really have to understand all medical conditions, not just a mental illness. You are doing rotations in all the specialties, ranging from internal medicine to surgery, and then you have a short amount of time actually in your psychiatry rotation to really decide whether that's something that you want to do. I think what's hard is that everyone's experience with their rotations and the quality of their experience and what they walk away actually knowing is just so different based on who your attending was, who your team was, the patients that presented to the clinic or the hospital during the time that you were rotating. It can be really difficult to sometimes make up your mind if you're not so sure by the time that you got to medical school's rotations in your third or fourth year. It's also interesting to be able to understand the psychiatric manifestations or behaviors that might be associated with a medical condition, which is definitely part of our specialty. Your body and your mind are very much interconnected, and so a lot of medical conditions actually manifest with bodily sensations. A lot of people who might be experiencing panic attack for the first time might end up in the emergency room thinking that they're having a heart attack or asthma attack. Similar but different is actually a medical condition that is stemming from someone's mental stress. In order to be able to address something like this, you want to make sure that you've ruled out everything that could be possibly happening medically, and what's left then would be something that might have been traumatic or had caused significant stress that maybe the patient hasn't been able to talk about or address in therapy or with medication. And I've talked about this before, is that it's always a combination of both. I emphasize therapy so much with everyone that I work with that medicine isn't necessarily going to teach skills. It's impossible. But it can really help you be able to tolerate therapy when you're talking about something so difficult. And I'm not a psychologist, obviously, and so I haven't gone through that training, but in terms of my understanding of what would be different, definitely the medical aspect of it is the obvious one, and their training is very much focused on the therapy aspect of things, and a lot of them also focus on either clinical or the research route. A lot of the clinical psychologists I work with also do research. So I don't want you to ever think that pursuing any of these careers forces you to cut out completely something that you're really passionate about. I also don't want you to feel like the research is necessary. There are plenty of people who do psychiatry and psychology that don't necessarily make a career out of doing research. I think it's important that we understand the science behind what we do, and so that's important. Therefore, appreciating the science and research and understanding the studies makes a huge difference in the quality of care that you provide. However, I think a lot of people get scared away when they do bench work in college. They think that that's something that's required of them moving forward in terms of their career, and I just wanted to kind of say that that's definitely not. As it pertains to any type of medication issue, because we're the prescribers, that would be a question for the psychiatrists. It doesn't mean that psychologists wouldn't know some of it, and the best psychologists I know understand when one medication would be used over the other. So in summary, whenever I get a question like this in the comments, I generally tell people that if it's not until after all 4 years of medical school that you actually get to choose a specific specialty, and I do think that's important. Even though you might go into medical school thinking that you want to specialize in something, you might do a rotation and be wowed by it, and that is exactly my story, where I went in thinking I wanted to do pediatrics, but really I just knew I wanted to work with kids and families, and pediatrics was the only thing that I knew would allow for me to do that. Psychiatry, like other specialties, has its own residency program, and then you subspecialize into treating child and adolescents. So that's something that I would encourage you to look at too. Hopefully that answers some of your questions about what the difference is between psychology and psychiatry. I've learned slowly through the years that Even within psychology, there's just so much depth and breadth of what they can possibly study, and especially in academia, it seems like they really subspecialize within the field of psychology even more. The time that's required and the money that's needed to complete training, attend school, be able to take on loans if that's what you need, is still a luxury for a lot of people. It would be unfair for me to not mention that. Are there people that aren't able to go to medical school because of their time and money? For sure. And I'm sure that applies to psychology as well. I wish it wasn't something that we had to consider, but it definitely is. What I would say generally is that if you're feeling really passionate about the work and it is something that really makes you feel like you're giving back to the world, then I'd say it's worth it. If you're feeling like the time and especially the money is not worth it, then I worry that long-term that might not be a sustainable career for you. If you don't have to worry about any of those things, then congratulations. Hopefully the things that I talked about in this video helps you clarify which career path you want to go down. Let me know in the comments below if there are more questions that you have about psychiatry versus psychology. I'd be happy to answer it to the best of my ability, and I appreciate all the interaction that I have with you in the comment section. Let me know if there are other things that you're wondering, and that helps me decide what videos to film. And I'll see you at the next one. Have an awesome week.